Hello students, we will discuss a pathology specimen today which is surgically related. Look at this, what this specimen is. So you can see that mucosa here, cut end of the specimen bowel, you can see anal canal skin, you can see anal margin here, you can see just proximal to that, and you can see a lesion here, proliferative lesion, ulceroproliferative lesion here, just above the dentate line. See that less than a centimeter above the dentate line. You can see the anal canal here, skin. So what this specimen is, rectum. So surgical excised specimen. So naturally you can see the proliferative lesion there. So it is a surgical excised specimen for carcinoma rectum. So it is after abdominoperineal resection. Often we call it as APER. All of you know that we do different surgeries when carcinoma rectum, which is commonly adenocarcinoma, it's very close to the low anal canal, anal margin, then it is difficult to retain the anal canal, so that with the maintenance of continence. So in such a patient, you have to remove the anal canal with the rectum and do a permanent end colostomy in the left side iliac fossa through the sigmoid or low descending colon, and it is called abdominoperineal resection. It is the APR specimen. With the proliferative lesion in the lower anal canal. If growth is little high up, you've got a good length above the anal canal, then you can do a what is called as a low anterior resection or anterior resection, where you resect everything, then anastomose colon to the lower rectum or upper anal margin through a stapler, circular stapler passed perineally. So that is very close here, that you won't be able to get a clearance, so you won't be able to get a continence, and so that's why it is APR is done. So that is APR specimen with the carcinoma rectum proliferative lesion showing there. How to describe specimen? It is abdominoperineal resection specimen done for carcinoma lower rectum. One can see anal canal, perforation, rectum proximal. Already I have discussed. Histological adenocarcinoma is the commonest type. Remember, sometimes squamous cell carcinoma can occur, adenosquamous can occur. It's very common. What are the different types of surgeries for carcinoma rectum? I already told. APR, anterior resection I already told. Do a stapler, you can do. The anastomosis also probable, but ideally circular stapler. Low anterior resection, still low you go to save the, avoid the permanent colostomy, which happens in APR. Ultra low anterior resection, intersphincter resection also when techniques, facilities are available, we can do, but clearance, most important is clearance. Without oncological clearance, we can't do any surgery, because that is the most important thing in any malignancy. Oncological clearance is the prime thing. Based on that, you decide depending on the individual patient. Of course, small mucosal transanal endoscopic surgeries, the different surgeries, you can always go through my book for details about each. So read my clinical methods in surgery, how to do rectal examination. 90% of the carcinoma rectum is diagnosed by rectal examination. If you don't do detailed rectal examination, your examination is incomplete, especially any patient with the bleeding. It is need not be piles, it need not be fissure, it need not be fistula. It could be carcinoma rectum or carcinoma rectum. So patient says it is piles. For everything patient especially is piles, I got piles. But it is, as a clinician, your business to do rectal examination compulsorily in all bleeding per annum. That is essential for it. Otherwise, we'll miss carcinoma rectum. It will be unethical and it will be negligence. And so go through how to do rectal examination, go through my clinical methods in surgery, which you got a video also how to do that, and detailed explanation also. There are different procedures, different methods, different postures also. My operative surgery you can read about carcinoma rectum in detail, and surgical procedures, how to do AR, APR, in detail, step by step is there in operative surgery. Suturing technique is there in tissue approximation, and Diginor lectures will give everything about in detail about all these aspects. As far as syllabus is concerned, carcinoma rectum in detail it is given. You can go through my Diginor through JP Publisher and subscribe for a year. It will give entire knowledge about surgery as far as UG, CBME syllabus is concerned, and basic for the postgraduate. So students, I hope you understood the specimen carcinoma rectum very well. It will be kept as a oxy specimen in the exam specimen part. So it will be discussed all these things during your practical examination. Carcinoma rectum is a main question for your theory also. So there also it is very, very important. So thank you very much.